Okay, so first I would start with my neuro. So I would make sure he's alert and oriented. I look at his language, his perception, his sense of like reality. I would ask my orientation questions, and then I would look at affect and just his behaviors. And I would have looked at his gait as he was walking in. Then I would move to integumentary, so I'd look his skin over. Color looks appropriate for race. He's nice and tan. I don't see any open lesions. Moles, if I did see moles, I would use the ABCDE, so I would look for asymmetry. I'd look at the borders. I'd look at color. I would look at diameter, and then I would look at elevation, which he does not have any, but that's what I would do. And then I would move to palpation, so I would assess the temperature, which is nice and warm, but not hot. I would look at his skin turgor, which is good. And then I would also look at the hands and nails. I would look for any clubbing or any broken nails, brittle nails, which his are all look good. They are nice and good. The cap refill is less than 3 seconds. Good. And then I would move to the hair. So I would look at his the hair distribution all over the body. It looks appropriate. And then I would look down the legs. The hair distribution looks appropriate. And then that's it for integumentary. Okay, then I would move to the head. So I would inspect, I'd look for symmetry, any lesions, any open areas, and I could look at the scalp too while I was up there. And then I would move to palpation, so I would palpate the facial bones. Good. I would know any tenderness or any open areas, and then I would palpate the scalp, doing the same thing, looking at temperature, any open areas, any rashes, or pain while doing that. And then I would look for symmetry with everything, which I did. I would also palpate the maxillary and the frontal sinuses. Any pain with those?
No.
No? Good. And then I would do the lymph nodes. So I do preauricular, postauricular, occipital, sublingual, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular, and none of those are palpable. Then I would move to the eyes. So I would have him take off his glasses. I would look right at his eyes. Good, they look symmetrical. Eyebrows are good. I would look at the conjunctiva. So I'm going to pull your eyelids down. Good, it's nice and pink. And then his sclera is nice and white, no redness. Pupils look equal. And then the irises are also equal and appropriate and blue. Then I would do for any, I'll do my cranial nerves later, but if I was doing the cranial nerves, I would look at a Snellen chart, a Jagger chart, and then I would do the confrontation test too. Then I would move to the ears. So I would inspect the ears, look for any drainage, look for any lesions, any open areas. Since he does wear glasses, I would look behind the ear. And then I would palpate the auricle, the helix, the tragus, and then the mastoid. To look inside, I would pull up and back. I'd put my otoscope in there. I'd look at the tympanic membrane. I'd make sure it's pearly and gray. And then I would look at the cone of light, which would be at 5 o'clock on the right. Left would be 7 o'clock. And then I would look at the tympanic membrane, make sure there's no perforations or any erythema. I would look at the cerumen, make sure it's appropriate color and that there's not too much. And then I would do my hearing tests, which the first one is the Weber test. So I would have a tuning fork. I'd bang it, put it at the top of his head and tell me which ear he was hearing it out of, which he should hear it out of both. And then I would do the whisper test. So I'm going to plug this ear. I'm going to whisper a word, and you tell me what it is. Apple.
Apple.
Good. Banana.
Banana.
Good. That is good. And then I would do the rin test for air conduction. So I'd have a tuning fork again. I would strike it. I would put it right back here in his mastoid. And I would have him tell me when he couldn't hear it anymore. And I would be timing it. And as soon as he couldn't hear it, I would move it out here and see if air conduction is greater than bone conduction. Again, timing it. It should be a 2-to-1 ratio. And I would do that bilaterally. Then I would move to the nose. So I would inspect it and palpate it for any pain. I already palpated the sinuses, so we're good there. And then I would look for symmetry. I would go up with my otoscope and look up there. I would look at the turbinates. I would look at the septum to make sure there's no deviation. I'd look for any drainage, any erythema. I think that's all I would do with that, yeah. Then I'd move to the mouth. I'd look at the lips, make sure they're not dry, cracked. They're the appropriate color. Then I would have you open your mouth, and I would look at his dentation. He is missing a couple teeth, but no caries. Good. And then I would look also at his ducts. So his Wharton's duct, and then the one underneath here, which is escaping me right now. But I would look at those. So I'd have you lift up your tongue. Good. Those look good. And then if I was to palpate, I would palpate along his inner mouth and his cheeks, and then I would palpate his tongue too. I would also look at the posterior oral pharynx and make sure his uvula good is nice and pink. It is midline. And that is what I would do for that. Then I move to the neck. So I would inspect the neck for symmetry. I would make sure the trachea is midline. And then I would look for appropriate hair growth, any open areas, any lesions, any discoloration of the skin. And then after that, I would palpate the neck. Let me know if you have any pain with any of this. Any pain?
No.
No? Good. Good. No open areas. It's all nice and soft. No lymph nodes seem to be palpable. And then I would look at the trachea again, make sure it's midline. And then I would go behind him if we were in a better spot, and I would palpate the thyroid and have you swallow. Good. And I would look at size, contour, symmetry, if there's any lumps, or any pain with that upon palpation. I already did the lymph nodes. And then back at the head, I would have done the temporomandibular pulses too. Good. Okay, anything else with the neck? Oh, I would do the carotids, so one at a time. Good, they're 2+. No worries felt. And at this time I could auscultate them too. So I would use the bell, and I would just go over it. Good. No breathe heard bilaterally. Then, okay, now I'm going to move on to the lungs and the chest. So I would inspect the chest. I would look for any sort of, if there's any sort of fractures or any open areas, any lesions, any trauma. I would look for a rate and rhythm and make sure they're normal and he's not in any distress, which he's not. It looks regular and it appears to be at a normal rate. I would also look for work of breathing using accessory muscles or chest retractions, which he is not doing. Then I would, I would start by palpating through the chest. Good. I don't feel any masses or anything like that. I would start at I'm going to do this one time and that'll be my reference. So I would start at this right second intercostal. I would do the aortic. Right second intercostal is the pulmonic. And then we have the tricuspid, which is between 3 and 4. And then at 5, midclavicular on the left is the point of maximal impulse and where the mitral valve is heard. Good. And then I would percuss. I would have you laying down. For resonance and then cardiac dullness. Good. And then I would auscultate the lung fields with my diaphragm. Okay, nice deep breaths. Good. 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 Okay. While I'm here, I'm also just gonna do the cardiac heart sounds too. So again, aortic, pulmonic, tricuspid, and then the mitral. Good. I would do that with my diaphragm and my bell. And then, I'm going to do my tests. Well, let me point out my landmarks first. So we have the clavicles, we have the sternum, we have the suprasternal notch, the manubrium, the xiphoid process, the costovertebral angle, and the margin. And then we have supraclavicular, infraclavicular. And then you have midsternal, and then, midsternal, midclavicular on both sides. And then you have the anterior axillary line, mid-axillary line, and posterior axillary line. Okay, then I'm going to move to the back. So I don't know how you want to do it, but you can just stand, maybe. So I would look for my landmarks here. So I'd look at the 10th rib. I would do, what is that test called? The thorax expansion. So at about the 10th rib, I'm going to have you take a nice deep breath. Good, and my thumbs should move out and come back in, which they do. Good. And then I would palpate for any masses, the same as I did on the front. And then I would percuss back here too, using the ladder method. I would note for any CVA tenderness, so let me know if this hurts you at all. Any pain there? No? That's testing your kidneys. Then I would auscultate also. So I'd have you take a nice deep breath. Good. Good. And then you don't have to take any more nice deep breaths. I would just keep going back and forth all the way down using the ladder method. Good. And then I would do the landmarks back here. So the 12th rib. So this bottom one. The 7th rib. And then I would do the scapular line. Both sides. The vertebral line. And then I would do interscapular between, and then intrascapular is below the spinous process, C7 to T1, which is the most prominent. And that's that. Then we're going to do our specialized test. I'm only going to do it on the back since he's already standing, but you could do it both sides. So we are going to start with the whispered pectoraliloquy. So every time you hear, or every time I move my stethoscope, Alex, I want you to say 1, 2, 3. And I shouldn't really be able to hear it. It should be muffled. Ready, go.
1, 2, 3. 1, 2, 3.
Whisper it, sorry.
1, 2, 3.
Good.
1, 2, 3.
Good.
1, 2, 3.
Good.
1, 2, 3. 1, 2, 3.
Good.
1, 2, 3.
Good. Now every time you hear my you feel my stethoscope move, say 99. This is for bronchophony. And I shouldn't be able to hear it either. It should be muffled and distant.
99. 99. 99. 99. 99. 99. 99. 99.
Good. Now we're going to do Egophagy. So every time you hear or you feel my stethoscope move, say E. And if it sounds like an A, any of these, if they were positive, would mean that there's fluid in the lungs. So every time you feel it, say E.
E. E. E. E. E. E. E. E.
Good. Okay. That is done. Those were all negative. No consolidation noted. Okay, now you can turn back around. Actually, you can lay down. Now we're going to move into cardiac. So we will... Make sure I'm not... Okay. So cardiac, I'm going to... excuse me, Max. Excuse me. I'm going to inspect the carotids. I check for any pulsations, heaves. I'm going to have you turn your head to the left, Alex. Oh, other way. Good. And then I'm also going to check for the jugular venous pressure right now on here. So I would look at the point where I can see it pulsating, which I can see right here. Put this right here, and then I would measure, and it's going to be about 3. Should be less than 3, and we're at 1. So that is good. That is normal. I already auscultated my heart sounds, so then I could palpate. I already did the carotid pulses. I could palpate the precordium for the apical pulse. So the point of maximal, left, 5th intercostal, mid-clavicular line. It doesn't feel displaced. I could have him lie on his left side and bring that heart wall closer to his chest, which would help. I could also have him sit up, and that could help me notice any more murmurs. Or I could have him lean all the way forward again, bringing that chest wall, or the heart to the chest wall. I already auscultated the carotids and all of my heart sounds, so now I'm going to percuss the cardiac silhouette. Good. Okay. That is done. Normal rhythm. Just S1, S2, no S3 or 4. No gallops or murmurs were heard upon auscultation. And when I listened to his lungs, there was no adventitious sounds, no wheezing, no stridor, no rhonchi. I would also do the diaphragmatic excursion test. So I'm going to have you sit up a second again. Actually, will you stand again? Sorry. Okay, so I'm going to percuss. I'm going to have you take a deep breath and hold it in. Ready, go. So I'd percuss down till I feel resonance. Or percuss up till I felt resonance. Okay, you can let your breath out. And then I'm going to have you take another deep breath and percuss down. But you can let it out. I'm sorry, I need to refresh my memory on this, but okay. So that was that. Okay, I made it through all the cardiac. I'm just looking to see if I have anything else. I'm going to do my, so you can sit down, my cranial nerves quick since I have time. So one is olfactory, so I would have you plug one side of your nose and close your eyes, and then I would put a scent there, have him sniff it, and tell me what the scent is, and then I'd repeat it on the other side. Number 2, you can stop. Number 2 is optic. So I would do the Snellen chart, the Jaeger chart. I would test for color blindness. I would do the confrontation. So what I would have you do is take this off. And then I'm going to have you cover up one eye. And I'm going to cover up that same one. And I want you to tell me when you can see my fingers. Ready? Go.
No. No. No.
Good. And those match. And we would do that bilaterally. And then 3 is oculomotor, 4 is trochlear, 5 is trigeminal, but I'll do that later. 6 is abducens. So for this one with the eyes, Oh, excuse me. With 2, I would have done an ophthalmic exam too, which I already talked about. And then I would do for 3, 4, and 6. I would do. I would check the perla, make sure they're equal, round, and reactive. I would look at accommodation in both eyes, and then I would also do the confrontation test. So I'm going to have you close one eye again, look at something behind me. Good. I'm going to watch the pupil dilate, and then I'm going to have you take this down, and then look. Okay, sorry. And take that down and look at the same thing. Okay, let's try that again. Do that, look at that, and then take this down and keep looking at that thing. Good. And you saw his pupil restrict. Good. Okay. 5 is trigeminal. So I'm going to have you clench your jaw. Good. Open it and go like this. Good. Any pain with that? I don't feel any popping. Good. And then I would have you close your eyes. And I'm going to just have you tell me where you feel this. Where'd you feel this?
On the forehead.
Here.
Cheek. Chin. Nose.
Good. Okay. And then we already did 6, so 7 is facial. So I would test his sensory with the anterior 2/3 of the tongue with sour, sweet, salty, and bitter. And then I would have you do a couple motions. I'd have you raise your eyebrows, close your eyes tight. Good. Puff out your cheeks. Smile. Frown. Good. Okay, that is good. 8 is vestibular cochlear, which I already did all those tests for. And then I would do 9, which is the glossopharyngeal. So I'd have you say, ah.
Ah.
Good. Now I would look at his uvula, which looks good. 10. What is 10? I'm sorry, I'm having a brain fart. 10 is the vagus, so I would do the gag reflex, which I won't make him do because he hates that. 11 is spinal, so I would have you raise your shoulders against me. Good. Turn your head that way. Against me. Good. And then go back. Go forward with your head. Good. Those are all intact. And then 12 would be the hypoglossal, so stick your tongue out at me. Good. And then push your tongue against the side of your cheek on the inside. Good. This side. Good. Okay. Those are all normal.